Hey guys, we're here again today with another episode of Dr. Travis McDermott, Vegas Vet. Today we're going to be talking all about discharge instructions. So basically this is what do you do when you go home from a surgery or a dental. And obviously every surgery and dental can be a little bit different, but we can give you some basic ideas of what to expect, what to look for, what to do. And that way you're not too scared by it. We will oftentimes come up and talk with you or have a technician talk with you about these things, but sometimes it's nice to have another reference and know what to expect maybe before you go in. So we'll start with spays and neuters. Most common surgery that we do when you come pick up in the afternoon, this goes for both spays, neuters, and dentals. Your dog's probably going to be, or cat, is probably going to be a little bit groggy. That's normal. Every animal, like every person, responds differently. So some are going to come out of it quickly and act like nothing ever happened. Some are going to be pretty groggy. Usually the older they are, the harder they take it. So some of these really older babies that we have to do teeth cleanings on, sometimes it can take them a day or two to really come out of it completely. So don't be surprised if you come in, but we will not send them home if they're not walking on their own. So you're not going to come pick them up and them be laying down and not being able to walk. We just won't send them home that way. We'll keep them if they're not completely recovered. And a lot of that depends on what time they were done. On a normal day for us at Durango Animal Hospital, we could have 10 surgeries and 15 dentals. So obviously we're doing those most of the day. The patients that are done at 8 o'clock in the morning are going to be much more awake than the ones that were done at 3 o'clock in the afternoon. So, but we do try to get these guys home to you in a timely manner. So for your spays and neuters, when you come pick up, important things. Number one, they're going to have a cone on them. Leave the cone on them. Don't let them convince you that they can't live with it on, because they can. They can eat with it on, drink with it on, sleep with it on, go to the bathroom with it on. It's vital for them to heal, especially males. So males especially like to lick at the incision. If they lick the incision, it will get infected. You can pretty much count on it. And oftentimes if we don't follow the simple rules that we have for discharge, while they seem arbitrary, you can end up spending more on the repair of something than you would on the actual surgery itself. So we want to protect your pet, make sure that neither one of you guys have to go through it and you're not back here again having something fixed. So cone, I normally tell people, stays on for about 5 to 7 days. People vary on how long they leave it on, but that's the best balance I've come up with not driving people crazy with having the cone on for too long. So cone goes on. Our incisions for spays and neuters, we do not use stitches on the outside. Some clinics do. There's nothing wrong with it. It's just a personal choice. So all of our stitches are underneath the skin. So they are dissolvable and they will dissolve. Now, it's not abnormal if you feel bumps a couple of weeks after surgery on like either end of the incision. So you'll feel like a firm lump. What that is that's the body reacting to the suture in there. So at the end, there's knots on each end where we tied all the suture together. So that's the most common place for it to occur. As the sutures dissolve, that will go away. So you don't need to stress about that. If it worries you, bring your baby in and your vet can take a look and make sure there's nothing to worry about. But that's something that does happen sometimes. Okay. Activity. So with our spays and neuters, we want them to take it easy for good 3, 4, 5 days. Obviously a bigger dog can do a lot more damage than a small dog. So Chihuahua's going to have a lot harder time tearing a stitch out than a German Shepherd. So just keep that in mind. Especially with our neuters. So neuters are at risk for something called a scrotal hematoma. It's pretty much about as bad as it sounds. So what happens is that if they get too active after surgery, they will rupture a blood vessel in the scrotum. It will fill up with blood and it'll look like they haven't been neutered, or it'll be swollen up the size of a grapefruit or bigger. It's not a life-threatening condition generally, but what it is just more of a pain to deal with. So it's prone for infection. Sometimes we have to go back in for surgery, and like I said, it's just easier, more convenient, less painful, cheaper to not have to deal with that. So with our males, especially our bigger males, we need to keep them quiet. It's very important after surgery that they stay quiet. Like I said, it seems like torture, but a few days of torture is worth not having to go through something like a scrotal hematoma. So spays and neuters, that's going to be, as far as the instructions, that's going to be the big part. The other thing is that we send you home on anti-inflammatory pain medication, okay? They do get an injection. So at the Durango Animal Hospital, we work very hard to make sure that we do a good job with our pain control, okay? So we used a balanced approach. They get what's called an opioid. It's going to be some of your stronger medications, kind of like similar to morphine. They get an anti-inflammatory as well. It's going to be carprofen is what we're going to use. Very similar to like Remedil, basically, that you would give by mouth. These are things that are going to work together and make sure they're not painful. So they already have an anti-inflammatory injection the day of surgery, so you don't need to give them anything. So we will send you home with pills. You're going to want to start those the next day. And try to finish those out, because they may not act painful, but they may have some inflammation that we want to make sure goes away. So that's going to be the big thing as far as the meds are concerned. Now, speaking of acting painful or thinking we're painful, we get a lot of calls occasionally from people who say, oh my gosh, my dog went home and they were painful last night. And maybe it's not even a surgery, maybe it's a dental cleaning where there was nothing done. What I will normally tell people is that it is not abnormal for dogs and cats to be a little moany, a little vocal after surgery. It's something called dysphoria usually, which basically is where they just feel out of it. They're confused from the anesthesia. We can express that by talking, they can't, so that's how they talk and that's how they express it. So most of the time, if you put them in a dark, kind of quiet room, it will help make sure that it lessens the effects, because the stimulus from the lights and the sounds make it worse. So those are going to be the big discharge instructions for our spays and neuters. Dental is going to be very similar. Obviously, most of the time we're not going to have incisions that we're going to have to worry about. We do want them to take it easy. And if they had teeth pulled, we're likely going to recommend soft food for a few days and then rechecking to make sure everything healed up okay. As far as eating, for all of our anesthetic procedures, spays, neuters, and dentals, we're going to say it's okay for them to have food that night. Now, most of them are very hungry because they haven't eaten since the previous day. So it's important that we give them a little bit of food. Some of them may not be hungry at all. So, it just depends. If they don't eat, don't stress about it. But I normally don't recommend giving them their full amount of food, because some of them will just eat it real fast and then throw up because they haven't eaten since yesterday. So half food, and then the next day they should be back to normal. Things that you want to watch for these guys, as far as what's going to be an issue, something you need to contact your vet about. And obviously any kind of bleeding or discharge. Lethargy, kind of exhaustion, tiredness that night is going to be normal, but if that continues for more than the next day, then we need to contact them and make sure that everything's okay. Definitely bring them back in. I always say contact your veterinarian, but you can call us all you want. A lot of times it's very hard for us to tell you what's going on unless you bring them in. So if you're concerned enough about them to call, likely it's going to be something worth bringing them in to see the vet. It's usually a quick visit just to make sure that everything's okay and there's no problems. Also, we'll look for swelling, redness around the incision. Those are going to be the big things. So these are what we think of when our pets go home from our procedures. And, important thing, as always, I always encourage all my clients, ask questions. If you're unsure about something, instructions didn't make sense, ask your veterinarian, ask the technician that's helping you. Just make sure you feel comfortable with it. That's the most important thing, is we don't want you to go home and stress about whether or not you're supposed to give something or not supposed to give something. So ask questions as always, and if you have questions for me, you can put them in the comment section below. You can like and share our video here on Facebook, as well as subscribe to us on YouTube so that we can get the word out about all these things. So look forward to talking to you guys soon. We're going to have a surgery for you coming up on Saturday. It's actually going to be a 3-part series. It's going to start Saturday, and can have some fun stuff for you. Talk to you guys soon. Thanks.